Hello, I'm Dr. Philip Blair, and I want to tell you about magnifying the benefits of cannabidiol with ketogenic diet. Now, what is cannabidiol? I think that's the first question that everybody has. Well, cannabidiol is a 22 carbon molecule that works as a signaling molecule, much like other fatty acids within the body, telling the body what to do and working in specific ways. It has some striking benefits, anti-inflammatory, and I'll go into those in a few moments. But let me tell you a little bit about who I am. Now, I'm a family medicine specialist, and I've been working in medicine for the last 40 years. I went to the United States Military Academy. I went into the Army. I spent 26 years in the Army, and I'm a retired colonel for the Army. And I've been practicing disease management for the last 15 years, looking at people with complex diseases and trying to help them with the best methods in order to get them past their particular problem and get them to recovery. Now, what I've done is taken a group of people from a health plan, from a self-insured company, and I've been working with those people specifically so I can look at the claims, I can see what's happening with them and the problems that they're encountering. And as a result of using dietitians that are fully trained in a ketogenic diet, we've incorporated a ketogenic and a low carbohydrate program for each of these people in order to enhance their recovery and reduce any medications and prevent complications. We've been astonishingly successful at doing that. And the company continues to ask us on a regular basis to renew and provide more services, and we've been expanding this for the last 6 years. So it's an excellent program, very, very well. But you know what? It wasn't quite enough. We've been focusing on types of problems that you see every day. And the ketogenic diet has been ideal for making a difference for these individuals. We've been able, with the ketogenic diet, to get people off of painkillers, reduce their analgesics or whatever they're taking, reduce the medications and the anti-anxiety agents, and even the biologics we've been able to reduce using a ketogenic diet. But as I was saying, it's just not quite enough. You know, ketogenic is really, really good for and established for things like diabetes, for epilepsy, autism, and cancer. Very, very effective. But it's not 100%. And in fact, the ketogenic diet for many people is just very, very difficult for them to do. And if you're not already schooled in low carbohydrate and a ketogenic diet, it's a difficult step to move to that level. So we were looking for a way to bring some of the benefits to these people using herbal substances that could take them to the level of relief and resolution for their problems quickly, and then incorporate the ketogenic diet on top of that. The advantage was by magnifying the benefits of both of these approaches, we could get an ideal outcome and reduce the expenses and the costs for the insurer as well as the business, and make people much, much healthier at the same time and resilient, and really changing their lives. And that's what I want to do, and that's my goal, and the dietitians I work with, we want to change people's lives, and this is a great way to do it. Now, let's talk a little bit about cannabidiol. I know what you're thinking, okay, this is coming from cannabis. Oh my God, that's illegal. Well, in fact, you've got cannabidiol that comes from industrial hemp that's legal throughout the United States. It's in South Africa, it's in UK, and it's available without a prescription. No limitations on the use of it. It's non-toxic and non-psychoactive. See, that's the deal with cannabidiol, is it's the non-psychoactive portion of the cannabis substance. And so you're taking this anti-inflammatory, anti-cancer, neurotransmitter modulator, immune modulator, and you're using that to work with the ketogenic program in order to work on the same things. It just so happens that cannabidiol has been shown to be quite effective for diabetes, epilepsy, cancer, and autism. All of these things that we're talking about with ketogenic diet work the same way with cannabidiol. So put them together, make the impact on these illnesses quite dramatic by combining the benefits of both of these substances. It's clear that we want to get people to a healthy point where they are using their lifestyle in order to maintain themselves. But for some people, they just need a boost to get there. Now, that can be a ketogenic diet, but it can also be cannabidiol. Now, why is cannabidiol, why does it do that? In fact, why does ketones, why are they effective in changing people's trajectory in terms of these chronic illnesses, autoimmune conditions, cancers, autism, and epilepsy? Why? How do they work? Well, they're actually signaling molecules. It's a lot like, for cannabidiol, a lot like the omega-3s, is that they're not metabolized. The value of omega-3s is not in their metabolism being burned for energy. It's their value in signaling the body to make changes in their metabolism, to changes in their immunologic structure, and the response to the brain, the neurotransmitters that are there. You're going to change those with ketones, and you're going to change those with cannabidiol. Combine the effects and get a magnification that is quite exceptional. Now, cannabidiol, as well as the omega-3s and the ketones, are working within the endocannabinoid system. I know that may be a strange word for you all, because we certainly know about the endocrine system, but the endocannabinoid system, we have our own cannabinoid system right here inside of our bodies. We've got everywhere, in every organ, in every system, we have endocannabinoids. And they turn out to be the master regulator for our metabolism, our sleep, our appetite, and if there's obesity or disease processes, it's involved with that too. It's involved with the hormones as well. So you got all of these major areas of concern, and the gut is loaded with these particular endocannabinoids and interacting as a major player in the inflammatory and irritable bowel conditions that we see on a daily basis. When the endocannabinoid system gets out of balance, you develop one of these conditions. And for every disease that we have, every significant major disease, we are finding consistently there are endocannabinoid dysfunctions that are occurring, deficiencies that are happening within the body. And that is correlated, but we haven't got causal evidence for the endocannabinoids actually causing those diseases. But it is very, very closely related. And the sense is that if we can balance those endocannabinoids, then we can restore the body back to homeostasis. And that's all we're trying to do with cannabidiol, and that's all we're trying to do with ketones. We're trying to restore the body back to full balance so that it can be resilient and recover quickly from any stresses that come under it. Now, you know that ketones are effective for reducing inflammation. But they're acting as a signaling molecule right down to the mitochondria, changing the metabolism of the cell, making it work differently, and they are affecting the macrophages, those immune cells that create much of the inflammation and the responses that the body has, both to obesity and to different types of diet, as well as the microbiome. The feedback can go through these particular macrophages and signal the body and create inflammation, whether that's in the brain or in the pancreas or in the fat tissue where we have it. Cannabidiol is very much the same, and I discovered this after reviewing literature on cannabidiol during the last 4 years and treating people using cannabidiol for a wide variety of conditions. And I'm seeing the benefits, those anti-inflammatory things that we talked about. It's there, just like ketones. CBD is doing the same thing. Plus, it's doing work on the neurotransmitters. Again, much like the ketones, they're affecting our neurotransmitters. They're calming them down, reducing the epileptic focus that can occur with epilepsy and the excitability of the brain in particular types of trauma. We got CBD doing much the same thing. Now, it doesn't seem to be that they are doing exactly the same thing, at least the same mechanism. They seem to work together in a combination, in an integrated fashion that is really unlike any other approach that I've ever seen. So combining the two could lead to just terrific responses and recovery from some of the chronic illnesses that we never thought we would be able to recover from, that we'd get resilience, things like resolving diabetes, resolving epilepsy, and correcting for much of autism, and helping with cancer and putting cancer into remission. And these are all very important things that we have the capability to do with this combination or separately. But if cannabidiol is available and you've got the ketone, if you can bring the person to a ketonic diet, then that's the best of both worlds. Now, the advantages of using these two substances together go on. And that's one of the reasons is because with a ketogenic diet, you're taking in large amounts of fat. Most 70, 80% of your diet is going to be fat. And you are already familiar with the need for balancing the omega-3s and the omega-6s. Well, it turns out the omega-3s are 22 carbon molecules, particularly DHA, and it's the same number of carbons that is in cannabidiol. And they work in much the same way as signaling molecules to change the metabolism, to change our response to inflammation. So it's working in a similar and an effective way to essential oils like omega-3s, but with an amplification that is really unparalleled in the medical pharmaceutical industry to speak of. Both of these substances and working them in combination really magnifies the effect on working on the mitochondria and shifting that over to oxidative phosphorylation so that you're getting much more energy production, much more efficient, and the reduction of reactive oxygen species that produce glycosylation as well as inflammation in so many parts of the body. Cannabidiol, just like ketones, reduces the hunger and improves the sleep quality. Now, ketones in some cases don't improve the sleep quality, but I'm seeing consistently that probably 70% of people do make significant improvements in their sleep using cannabidiol. Not by a direct action, it's not a sleeping pill, but it does improve the quality of sleep, probably by reducing the amount of REM, anxiety-related REM sleep that occurs, reducing that portion of it and leaving you in more time periods of deep sleep. Now, when you're taking in these other oils, that facilitates the taking in of cannabidiol and the absorption of cannabidiol and the delivery to the bloodstream as well as to the brain. So you're going to get better combined effects by using the two substances together. Both of these are going to be working on those major illnesses that we talked about a little bit earlier, the diabetes, the epilepsy, the autism, and the cancer. Now, with respect, if you're not doing it for an illness and you're looking for resilience and recovery and performance, this is an excellent approach. What cannabidiol has, I've seen consistently, is an improvement in visual focus. So we're talking about your eyes, you're having better vision using the cannabidiol. There's mental clarity and focus on what you're doing at any one particular time. In addition, I see a reaction time that is improved using cannabidiol, ability to hold your breath longer, and decreased symptoms related to anaerobic type of conditioning. So when you're doing those sprints, you may find yourself with greater tolerance to do those sprints a little bit stronger. At the same time, you have the ability to reduce the inflammation that might come after building muscle. When we know that's part of the process, we need to have a little bit of inflammation, but oftentimes it gets overblown. Cannabidiol will reduce that, help with the recovery from all injuries, whether it's a laceration, a burn, or an injured muscle, or a sprain. All of these things respond superbly with advanced healing using cannabidiol. And then combine that with the ketones, and you've got a great combination that can really make a difference for every individual. Now, I've put some of my information onto the posting for this webinar, and I do want to remind you to please subscribe to Adapt for Life. The program that they have is superb, and if you want to hear more from experts about ketones and this whole field of cannabidiol, I please subscribe and carry on with us. Thank you all for watching.